Welcome everyone. I want to thank community members and members of the press, city staff who are here participating in this 7th annual State of the Public Safety Report to our community. Thanks to our three presenters from whom you will hear soon, each a leader in public safety: Chief of Police Mike Dekoff, Director of Community and Family Resources Department Beverly Callender Anderson, and Fire Chief Jason Moore. I recognize we have some elected officials in the office. Good to see City Clerk Nicole Bolden. Glad to see you here. I see City Council Member Isabel Piedmont Smith. Am I missing any others? Thank you for being here as well, and thank you all for being here. First, an acknowledgement. As mayor, I like to do this in official proceedings. We recognize that the city of Bloomington sits on native land. The city, as well as city administrative buildings like this, are on traditional homelands of the Miami, Delaware, Potawatomi, and Shawnee people, and we acknowledge they are past, present, and future caretakers of this land. We also acknowledge that much of the economic progress and development in Bloomington and Indiana resulted from the unpaid labor and forced servitude of people of color, specifically enslaved African labor. We acknowledge that this land remains home to and a site of gathering and healing for many indigenous and other people of color, and commit to the work necessary to create and promote a more equitable and just Bloomington. So this annual State of Public Safety Report is important because it provides our community fundamental data points on how we are doing with keeping our community safe. And safety is a most important part of the quality of life people in Bloomington know and enjoy. Sharing this data publicly since 2017 is part of the accountability that we embrace, and it helps us together identify patterns and progress as well as persistent problems. Residents and other interested parties can keep up to date in other ways too. Our open data portal, Be Clear, gives access to more than 200 data sets, including crime statistics, budget status, officer training hours, and much more. And the resident-led Board of Public Safety meets monthly in public session for all to hear regular detailed reports on our activities. Now, without further ado, this year we will hear directly from our three leaders in turn, and then I will make some closing observations and announcements, and then we will open it up for questions from the press or the public at the conclusion of the presentations. So first, and you'll hear directly in order, first we'll hear from Police Chief Dekoff, then CFRD Director Callender Anderson, and then Fire Chief Moore. Chief Dekoff.
Thank you, Mayor Hamilton. Welcome, everyone. So I have to try to navigate this remote, my notes, all at the same time, so bear with me here so I don't get too far ahead of myself. So we're going to start today off with just some what's happening in Bloomington. So I'm going to present a bunch of statistics first, and then we'll go into the second part of it, which is the men and women of the police department who are responding to all these calls. So this is a snapshot of calls for service over the last several years. And you'll notice in 2022, we had 54,000 calls for service come into the dispatch center for the police department. It's an increase from the last couple of years, but 20 and 21, we were dealing with COVID-related circumstances, and so there were fewer calls for service, but we are back up in 22 with numbers that we had seen prior to COVID. This is just a comparison of all of the agencies that the Monroe County Central Emergency Dispatch Center dispatches for. You'll see the Bloomington Police Department is at the top. We are the largest agency with the most calls for service, and then we go down to the other law enforcement agencies, the fire departments, and the ambulance service. Let's talk a little bit about comparison of crime totals. From 2020 to 2022, you will see that murder is at the top of the list. We had 5 homicides in 2022, which was an increase over 2021. Attempted murders are up in 2022 over the previous years. Rapes and forcible sex offenses, those numbers are up slightly in 2022. Robberies were down in 2022 versus the previous years. Assaults were slightly up from the previous years. Domestic battery calls were also up. Child abuse was down in 2022 versus 21. Neglect was up just slightly. Burglaries were down actually quite a bit from the previous year. Larcenies were slightly down. So property crime has actually decreased from the previous year, is what we're seeing in these numbers as well. Operating while intoxicated, those calls were up more. Public intox was slightly down. Some of the reasons for that is the state changed the law on public intoxication, so fewer arrests were made. And vandalism and graffiti, which are quality of life type crimes, were also down. In looking at these numbers, one can look and see in comparison to the previous years. Some of them are up, some of them are down. COVID did have an impact on some of those numbers. And if you can think about, like with COVID, if you look at the robberies, there were, less people were out and about, or more people were out now, less people were at home, and so more things got reported. So there's a variety of different reasons why some of these are up and some of these are down. Looking at the traffic stops, starting in 2012, we have those numbers have dropped until we got to 2016, which there was a slight increase, and then started back on a downward trend, and started back up in 2022. And again, more people were out from the last couple of years driving, and so those numbers are slightly up. Motor vehicle accidents, there are 3 types of accidents that we investigate. There are property damage, there are personal injury accidents, and there are hit and run accidents, and that's just kind of a summation of the last several years on the types of accidents that we investigated at the police department. Let's talk a little bit about violent crime. So throughout 2022, we had 611 incidences where weapons were involved. Now, a weapon could be a gun, it could be a knife, it could be a pipe. So we saw a slight decrease in the number of calls involving weapons from the previous year. But what I want to focus on is the one with firearms. We had 132 incidences last year. Of those 132, 70 incidences involved firearms that were actually fired at a person. So when you hear in the news about shots were fired at a house or shots were fired, from a moving vehicle, those are the types of incidents that we are talking about. We have seen a significant increase in firearm-related type calls, which is concerning. Indiana recently, within the last year or so, changed the firearms licensing requirements. So now everyone, if they want one, almost everyone can have a firearm, which there are people that should not have firearms, and I won't take all of my time talking about that, but that is concerning to law enforcement, which did oppose the legislature changing the firearm regulations, and that was opposed by law enforcement leaders throughout the state. A little bit more about gun violence. One of the things we started doing a lot more frequently in 2022 is we partnered with our federal law enforcement agencies, and when we had an incident involving a gun, where we either recovered a gun, we recovered bullets, or we recovered shell casings, we submitted those to our federal law enforcement partners where they analyze those. And the intent was to try to identify who might own that weapon, who might, whether or not that weapon might have been used in a previous crime. And so that was a way for us to start to try to identify the individuals involved in the firing of these weapons. So you can see in the slide, we submitted over 70 weapons to advanced forensic examination process, which helped us connect the dots with guns that are used not only in Bloomington, but in other communities, and tie those people to other crimes so that we can make arrests in those cases. Assault and battery up there is the definition of what a battery is. We had an increase in 2022 over 21 levels by 7%. I've talked about this in the past. The vast majority of batteries, the victim and the suspect know each other, and in over 60% of those crimes, they occur in a residence. So overall look at crime, the crime rate for the city decreased by 1% in 2022. Violent crime was up by almost 6%. As I stated, it's important to note that violent crime is not random, that in 80% of the crimes, victims know their assailants. And we continue to work with a variety of different social service agencies, advocacy groups to bring attention to this so that we can try to focus on de-escalation so that these crimes don't escalate into violent situations. So now on to the people that investigate these calls and respond to these calls. This is our organizational chart. It's also a snapshot of our personnel. We are authorized 105 sworn officers. Our staffing is currently at 88. We have 17 openings, which I can report. We just hired 5 new people that will start at the end of February. A breakdown as to the makeup of the officers is also on the screen. Our non-sworn personnel, which includes our records division, our dispatch personnel, our social workers, and our community service specialists are also up there. We are authorized 71, and we are currently at 55. Talk a little bit about hiring and recruiting. If you turn on the television or read newspapers about police departments and crime in general, police departments across the country are struggling to hire police officers. That's not immune to us as well. We struggle to do that. We have put in place incentives to try to help lure people to become police officers here. We have hiring bonuses for officers with previous experience of up to $5,000. For new officers, we have a $3,000 signing bonus. We have a take-home car program for officers who live in the city. Last year, we did quarterly bonuses of $1,000 before the contract that we just renegotiated that gave substantial raises to the officers, which took effect in January of this year. We have a rental assistance program that I don't know of any other department in Indiana that does this. We do a $750 a month rental assistance for an officer to live within the city limits, and we do up to an $18,000 one-time down payment to assist for officers buying houses in the city. In 2022, we hired 6 officers, but we had 11 officers who either retired or left the department and sought employment elsewhere. The hiring, it continues to be a challenge for us, but another thing that happened in 2022 was that there was a specific position put in the budget in the HR department to assist with police and fire hiring. And so we're in the process of interviewing for that position, and hopefully that will be online shortly to help us with this issue. Talk about training. We do a lot of training at the Bloomington Police Department. In 2022, we had 8,064 hours of in-service training, which equates to about 91 hours per officer, which is more than 3 times what the state of Indiana requires. Indiana requires a minimum of 24 hours of continuing education training. We do a lot of training. You can see the topics of instruction there on the right of the screen. But one that I want to talk about is the ICAT training, and ICAT stands for Integrating Communications and Tactics. It is a evidence-based de-escalation police training program that the Police Executive Research Forum, which is an international leader in police training and policy, helped develop. We have instructors at our department. They just went to a recertification training in January. We're looking at adding instructors because this training it's de-escalation, but it takes into account a lot of other things. And as you've probably read in the media recently about police culture, it also addresses police culture and brings that into training. Another thing that I want to highlight is all the training that you see on the right. If there is a way for us to work de-escalation training into that, we do that. So with our firearms training, with our physical tactics training, all that types of training, we are always looking at how we integrate de-escalation tactics into that so that we can do everything we can to de-escalate a situation. Talk a little bit about our records division. These are some statistics and some of the things that they do. One thing that I want to highlight is you'll see handgun permits in 2022. There were only 168 because you don't need a handgun permit anymore in Indiana, which is, again, that's something that I'm concerned about. But you can see the number of case reports that they do, the number of supplemental case reports, which are supplements that are added to an original report. So we have a full-time records division that is extremely busy making sure that all the paperwork that the officers generate, all the paperwork that the public might need from the police department, that we can answer those requests as quickly as possible. The Monroe County Central Emergency Dispatch Center is ran by the Bloomington Police Department. We are authorized 32 dispatchers. You can see there we have vacancies as well. But they dispatch for almost all public safety agencies in the county. The only ones we do not dispatch for are state agencies, such as the state police and conservation officers, and for the university police department and Indiana University affiliated law enforcement agencies. One highlight that was put in the budget for this year is that we are hiring another full-time police social worker that will be assigned to the dispatch center to assist the dispatchers in diverting calls to that are mental health related to mental health professionals. We have a lot of those types of calls, and we were looking for ways to lessen the load on sworn officers, and this was something that we came up with. We just recently visited Columbus, Ohio, where they have a program like this, and we saw for ourselves as well, but they talk about the successes they have when people who have a mental health issue call in. They can divert it to a social worker to help provide services other than sending police officers. Accreditation, this is something that I'm very proud of. We were initially accredited in 2018 by CALEA, which is the Commission on Accreditation of Law Enforcement Agencies. We received our reaccreditation in March of 2022, where assessors were sent and they reviewed all of our policies and procedures, did interviews, and we received our reaccreditation last year, which is about 5% of the law enforcement department population in the country is accredited. So this is a pretty big deal. In Indiana, there's roughly 15 agencies that are CALEA accredited. Talk a little bit about our police social workers. You can see the chart on the right has the years 2019, 2021, and 22. We started the program mid-year in 19 with one social worker. We expanded it to 3 social workers in 2021, so you can see the referrals that they get and then the actual client interactions. And it's a significant increase from the very first year to last year. With the addition of a 4th social worker that will be working in dispatch, we again hope to see situations that we can divert police calls to the social workers to deal with the the potential mental health issues that people suffer when they that call into the police department. Last year was our second national conference on police social work. You can see the numbers. We had over 130 people from 24 different states come to this. This was an idea that the social workers and I came up with because we are always getting phone calls from police departments around the country asking, how did you set your program up? How does it work? So we thought, well, let's just have a conference. And so it's been quite popular. We had 3 days of training, and this last year's was even better because we had a lot more people from around the country that have expertise in these areas participate in doing the training. And so it's become a very popular training conference for people who are interested in starting police social work programs or continuing the programs that they have. Our community service specialists are non-sworn members of our agency that respond to incidents like traffic accidents, traffic direction. They take minor reports on low-level crimes where there's no investigation needed. They do building checks for us. It has become something that we started in 2020 that started off small, but they currently take almost 5% of the call volume that we get on those minor calls that would not necessarily require a sworn police officer to respond, which again then frees them up to deal with more serious stuff, but we don't ignore the minor things because now the community service specialists take those calls. I'll note that in 2022, we also added 4 additional positions to the budget, and we are in the process of doing interviews to fill those 4 positions that will bring the authorized strength up to 8. Public engagement, as you can only imagine, the last couple of years we didn't do much of any public engagement because of COVID. We started back up in 2022 and had an almost 300% increase over the previous couple of years. Some of the things that we have done in the past with public engagement, we host a teen academy for middle school and high school students that might be interested in a career in law enforcement. We do the public safety cadets, which is, again, geared towards high school kids that have an interest in policing careers. We have done programs at Banneker. We have done rape regression defense, which is self-defense training. A lot of neighborhood meetings, department tours with different groups. And so community engagement is something that is extremely important. As the mayor frequently says, the more the public knows about the police and the more the police know about the public, the better things will be. And so that is something that we try to practice all the time with our outreach and engagement. And so the last 2 years was difficult, but we're back into it now, and it's something that the officers enjoy as well because we get to meet people kind of in different circumstances than what we normally would on calls. Transparency and data sharing. The mayor talked a little bit about the Be Clear portal, but we also provide information to the police data initiative. You can see the website is publicsafetydataportal.org. The bullet points on the right are all of the different data sets that we provide information to both of those data portals. So anybody that wants to know anything about, officer-involved shootings or complaints or use of force or hate crimes, whatever, can get on these public data portals and see what types of things are occurring here in Bloomington. This is something that we constantly are reviewing and looking for other data sets that we can present. And it gives the public an opportunity to get in there and look around and see what's actually happening here in Bloomington. Board of Public Safety, the mayor mentioned this a little bit. It's a 5-member civilian board that oversees both police and fire in personnel matters and they approve claims. You can see on the right some of the topics of the reports that they get every month, and those meetings are open to the public. Anybody can come. They have started to be carried on cats, I believe, as well. So it just kind of gives you an overview of what's going on with public safety. We present statistics monthly to them. They approve claims. And so it's a very active board that has regular meetings every month. Officer wellness is something that we are really paying a lot more attention to. If we have healthy officers, they make less mistakes and do their jobs better. And so it is also one of the pillars in the President Obama's 21st Century Policing Report. But our social workers are actively involved in this, and you can see some of the other programs and things that we do, such as the peer support team, police chaplain. We have a physical fitness facility that was upgraded last year so that the officers can go and work out at and stay healthy. And we also have in there the COVID vaccine incentives that the city provided so that more of our officers are vaccinated. 2023 goals. Again, we're going to continue to provide a high level of community-based policing services. We want to continue to address violent crimes by working with others to adjust it. The criminal justice system can't do this alone. We have to include community partners to do that. The recruitment and retention is also going to be a major focus in 2023. Another major focus this year will be the new police headquarters at Showers, which is on the back side of this building. The city purchased it, kind of a long process into 22, into 23, but it is now in the possession of the city, and we are already starting to work on the design and construction, which is expected to take most of 23 and into 24. That is all that I have. I would next like to introduce Beverly Callender Anderson, the Director of the Community and Family Resources Department.
Thank you, Chief, for that report. It's a great report. As he said, I'm Beverly Callender Anderson, Director of the Community and Family Resources Department. Before I get started, I want to tell you much of what you're going to hear in my report would not be possible without the members of the Community and Family Resources Department, nonprofit agency staff, and community volunteers. So I just wanted to take a moment to thank all of those people and everyone who is committed to advancing public safety in the city. Oh, okay. I don't know what I did. Okay, so looking back to where we ended our report last year, I'd like to bring you up to date on some of the things that we have done. And so last year we talked about Charles Culp, who was our new after-hours ambassador at the time. So he's been on the job now for about a year, a little over a year, and has become established as a downtown fixture and a resource for visitors, business owners, and people in need of services. We were looking then at increasing his capacity, and I'll tell you a little bit more about that later in the report. We also talked about helping Bloomington Monroe last year, which is an online portal for resources. It's a partnership between the Bloomington Health Foundation and the City of Bloomington. It's a 24-hour, 7-day-a-week resource hub, provides much-needed resources for people in need, things like housing, shelter, health care, food, clothing, and more. It is available to people who are service providers, for people who directly need services. They can access it online, and places like faith communities and everywhere else that people go to get services. So as managers of this resource hub, our staff also provides training and support to nonprofit agency staff, because staff can go in, they can update their information. Like if a telephone number changes or a staff person changes, they don't have to come through us to update that information. They can do it directly. And so we do provide that training. And anyone who is interested in accessing that can find it at helpingbloomingtonmonroe.org. We're also continuing to provide support to the Heading Home of Central Indiana and the Housing Security Network, both financially and by serving on their advisory councils. Last year, we started the Future of Policing Task Force, and that task force was created to help develop a vision for policing in Bloomington that was forward-thinking and responsive to community needs. And the task force consisted of 10 community members. We had three staff supporting them with the goal of developing a vision for policing, like I said, that's forward-thinking and responsive. Some of the activities they participated in were surveying 3,000 randomly selected households, researching community policing programs in other communities, participating in ride-alongs with the police department. They conducted focus groups with local nonprofit agency staff and clients, Chamber of Commerce, member businesses, and unhoused residents. They also met with our police department social workers to learn more about what they did, as well as did research on less lethal forms of response. In April, in April of last year, they issued a report with initial recommendations. And as we look through these initial recommendations, you will see some overlap of these recommendations and some of the information that Police Chief Decoff shared with you. They asked for an increase in salaries and incentives to ensure that BPD could be staffed up to par, increase in social and personal interactions between police officers and the public, annually convening public meetings to gauge citizens' perceptions of the day-to-day practices of the behavior of police officers, finding new and robust channels to publicize the good that is happening in the police department, looked at ensuring that officers receive training in intercultural and interpersonal communication, investing in an app, which is something that we've researched, to monitor the health of officers. We looked at sustaining required diversity training annually. It's something that the police department already does, but they wanted to sustain that, as well as having the police social workers coordinate with Stride and Centerstone and our community care specialist. In 2020, at the end of 2022, we updated what was called the Homeless Resource Guide. We rebranded it as the Downtown Resource Map and Guide, because what we realized is that whether people were unhoused or not, they could use the resources and services found in this guide. This is available in many downtown locations. It has resources for food, shelter, healthcare, public restroom locations. It's free. We have, since the beginning of January, distributed over 2,500 copies of this. We have other copies available if people are interested, and anyone that is interested can call the Community and Family Resources Department to get some for their location. And that number, in case you don't have it, is 812-349-3430. So this is, okay, that's fine. I spoke earlier about helping Bloomington Monroe. This graph shows a 3-year usage of that resource. What you can see from the graph is that housing or shelter has always been the most searched topic. But it has increased every year that we've had the hub. So in 2022, there were 8,979 total searches performed on helping Bloomington Monroe. And that's an increase of 44% over 2021. In 2021, we have 5,026. Housing and shelter, food and healthcare continue to be the top 3, but you can see that housing and shelter is 42.15% of the total searches. And so the next highest search is healthcare resources, which was at 13.3%. So each year, the city allocates $250,000 for downtown outreach grants, which we also administer. And from this page, you can see that every year our grants exceed, our grant requests exceed the amount that we have allocated. In 2022, we received requests for $340,145, and in '23, the grant request went up to $544,861. Again, it shows the need of what the nonprofits are dealing with each and every day. And so we hope that the money that we do have allocated, that we are able to grant out, helps, but we know that it doesn't solve the problem, but it does help. This is a list of our 2022 grantees, and they change from year to year, but Beacon, the Bloomington Homeless Coalition, Centerstone, Hotels for Hope, Middle Way House, the Monroe County Humane Association, New Hope, Sojourn House, Wheeler Mission. Those are where the grants went. Talked a little bit earlier about the After Hours Ambassador, and so because he's been around for a little over a year now, we are able to compare 1 year of his activity to the other. What we have been able to determine is that this position, which is a new position, very new for the city of Bloomington, is really needed in the downtown area and has really become a staple. And it's become important to downtown residents, visitors, students, and people in need of services. And so you can see from the first year that goal 25% was basically him getting to know folks downtown, him getting to know the businesses and the residents and how the culture of the downtown really worked. When you get to 2022, you can see that part of it has decreased because now people know him and he knows them. But where it has increased is the services to unhoused people or assistance for people in crisis, and that's gone up from 10% to 25% of his time over the year. The other place that has increased is just a little bit, 5%, is his support for downtown activities, the festivals, all of those activities that happen downtown, and getting people from one place to the other, giving directions, giving recommendations on where to eat or whatever if you have visitors. But also there's an increase in the amount of activity to students as well, working with students who are downtown. And so we do look forward to not only that continued work, but also developing a core of people who can increase that impact that he's having. So as we look ahead to the rest of this year, we're going to be administering violence prevention grants, and so that will be an investment of $125,000 for operational assistance into evidence-based, community-based, neighborhood-based programs that help prevent, interrupt, or reduce violence. We're going to coordinate a second round of QPR and mental health first aid trainings for community members and frontline city staff, probably frontline local government staff, could be city and county. For those who don't know, QPR is question, persuade, and refer. And those are the 3 steps that anybody can take to help prevent suicide. And we know that our frontline staff come into contact with any number of people all the time, and so to have those skills would be a plus and an investment in their ability to do the work that they do. We also are going to continue our work with the Divided Community Project that we started in 2019 with the goal of building community resilience and increasing our ability to respond appropriately to crisis situations. And so with that, I would like to introduce Fire Chief Jason Moore.
Good afternoon. Thank you for that. As she said, I am Jason Moore. I'm the fire chief for the city of Bloomington, and we're going to be going over last year and a little bit of what's to think about for this upcoming year. I like to start all of my presentations by reviewing our mission. The fire department is very mission-oriented. I will update one thing on this from the previous years till now. We've added mobile integrated healthcare, and we'll be talking a little bit more about what that means and what it is. But essentially, we always serve the public for public safety, excellent public safety, and I want to point out by credentialed, well-trusted, first-rate training and high-quality equipment, because that's not where we started this journey when I became chief, but that's where we're at now. So looking at last year, our operational call types, you can see the percentages. I will point out that in 2021, we saw the largest single increase from year over year of calls. We saw another increase in 2022, and some of the things that Chief Dekoff discussed and the mayor discusses about how we need to start diverting calls is becoming very important, because running this many calls is becoming a really strong burden on not only the sworn police officers, but the sworn firefighters. So again, our mobile integrated healthcare is one of those programs we've put in place to help divert some of those calls. Going from year to year, you can see that we went up 330 calls. Looking back, even back to 2016, we're almost double that call volume from 2016 till now. But biggest changes we had, a few of them were from administrative changes. Rescue and EMS went down. We also saw that our service calls went up. We reclassified what a lift assist is, so that's going out and helping someone that's not actually hurt. Knowing that we have ambulance shortages in the county, we actively went to help with some of these issues that we could, because we also knew that that would help us engage our mobile integrated healthcare programs. Other things are some of the things that we see year to year just fluctuate back and forth. But for us, it's really concerning to start seeing, again, the increases in false alarms, which in 2023, we do have a few things that we're going to work on that with. We also like to report out with IU. They are a big part of our community. You could see that other than the years of COVID, where there was some abnormal statistics, we're kind of on track. The bigger peaks come when the students start. We do actively engage programs when students do come to IU, and that's where you start seeing some of those decreases right after they get there. So from year to year, looking back, we're almost even to what we were back in about 2016. So a lot of our prevention efforts that we started kind of fizzled out with COVID, and we're bringing all those programs back to hopefully help drive those call volumes back down again. And here again, you can see from the year to year, they are up 70 from last year, but again, overall, they're fairly steady from the time that I've been the chief here. One thing we do need to talk about is our response times. So every time someone calls 911, they generally don't care what color the truck is, they don't care what emblem's on the truck, but they just want someone there quickly. We are reporting against the national standards for our agency. You'll see the boxes that are up there. There's 3 of them labeled for fire. There's turnout time, which is from the time that dispatch notifies us of the call until we are on the truck and actually leaving the station. There is the first arriving, which is from the time we leave the station until we arrive on that scene. And then the last one is what we refer to as total response force. That is based on the standards for ISO and the national standards, which is when we get the first two engines and an aerial truck on scene. The goal is to be there 90%, and you can see we are well below those goals. Knowing that we've looked into this, we have several things on the side that have affected it. We do expect the numbers to bounce back quite a bit once we finally get back into our Fire Station 1. Operating out of a lawyer's office that's been converted to a fire station was useful, it's helpful. We maintain a presence downtown, but it is not designed to be a fire station. The next set of boxes are EMS, which is emergency medical. We also track that for the turnout, which again is from when we receive the alarm until we get on the apparatus, and then the first arriving. And then there's not a national standard for all other calls, but if we're going to track everything else, why not just track that last one, which is everything else that's an emergency call. And that's the one that we got really close to our goal in, which is also a big chunk of all the things we do. So when we look at this, I like to say that we are data assisted, not data driven. If I were just to look at the raw data, we would say, oh no, what's going on? The city's unsafe, but we're not seeing poor outcomes. And I think that's really important to talk about, is not just the data itself, but the outcomes that we see. So even with not quite meeting these goals because of poor station design, poor placement, the construction activities, the damage that was caused by the flood, we are not seeing poor outcomes, which is a lot of deaths or other things that would happen if we were not getting there in time. Unfortunately, in 2022, we did have our first fatality since 2017. It was a preventable fatality, and we have been actively engaged in the area and those types of facilities that are similar to the one where that fatality happened to prevent future fatalities of that nature. There are very cities in the U.S. that could go back and say that we've had that many years of no fatalities, and that's directly related to all of the prevention activities that we accomplish, going out and ensuring smoke detectors are installed, getting out in front of students, teaching people, cooking things. And this is actually even more important now with our mobile integrated healthcare of getting into homes and seeing hazards before they become a fire. I will point out that even though we had a slight increase over the past couple of years, overall the slant, we are still on an overall decrease as a city for the number of fires. So the mobile integrated healthcare, I'm pleased to announce we had a goal, which we failed miserably of trying to get it done in the first quarter of 2022, but it was so new in the state that we actually were trying to build this as they were building all the requirements for a program like this. We did get it established in the fourth quarter. You can see here in the picture, these are our first 2 mobile integrated healthcare workers, and they spent the first quarter of their employment, so the last quarter of last year, building those relationships. So very similar to the nighttime ambassador, the first little bit, they have to actually learn how to connect people and what resources are out there. They also had to complete new requirements for training, which was not a requirement when they were first hired, but the state made it required. And I would like to point out that we are the only fire-based program south of Indianapolis currently that has one of these programs. In prevention, we talk about the 3 E's for us, which is education, enforcement, engineering. Obviously, education is one of the biggest components. If we can teach them all the way from grade school up, they generally do not engage in unsafe behaviors. Just like the police, we are seeing a bounce back to pre-COVID interactions, but we're still not quite back to where we were at peak right before COVID hit. But again, major improvements in the amount of community contacts, getting out into schools. We do have several departmental goals related to getting out to the K through 12 schools, direct work with Indiana University, and then, again, just providing that educational resource and smoke detectors and all those things. Enforcement, that's us getting out, whether it's a complaint, whether it's just getting out preventatively to find issues. Looking at the fire inspections, we currently employ a fire marshal, a deputy fire marshal. In '23, we are adding another deputy fire marshal, so we should be able to get close to our goal. We have never reached the goal of being in every business every year. The pre-plans, we talked a little bit at council and some other things. The fire department spends a lot of time trying to figure out how to deal with things before it happens. So again, these are not back to pre-COVID years, but we were out doing a lot of pre-planning on buildings. Engineering, this is where we try to do all of the preventative work before a building is even built, or as they remodel that building. The plan review process, we are one of the few entities in this county that do that for the fire side, making sure that as they build it is as fire safe as possible and gives us a little bit of leverage and a little bit of ability to handle some of the larger buildings that may beyond our personnel staffing levels can handle. Training is the pinnacle of what we do. We have to respond, but we have to also be prepared to respond. So we are pleased. We've set a goal back in 2016. We've constantly pursued that goal, and we've made it. Last year was no different. We made 103% of that goal. That's almost 43,477 hours. That is a lot of time spent training. But you also have to remember that we don't just fight fires. So, when we talk about reoccurring, that's everything just to make sure that we are staying proficient at what we do. New certifications, we've had a large turnover in our department, so we're having to increase the number of certifications to make sure people are qualified to do the jobs they're doing. Physical fitness is very important, a little over 9,000 hours of that. It is actually mandated, and just like the police, they started it, but we did jump on with a tactical trainer, which helps improve the safety and health of our firefighters. And then other and specialty, that gets into protocol, safe place, diversity training, so all the other categories of things that we train on. Just as city employees, we have to do HR training and all that. But that's where all it's captured, and then that is a lot of hours that we spend preparing to do our jobs. For administration, we did have an increase in our budget from 2021. I want to point out that of that increase, almost all of it went to starting remodeling projects at these stations that have not been funded by the bond. So the bond that was just passed was huge for our department. They had a 10-year capital plan, and there's always this magical 11th column, and those were the unfunded needs. So the bond is taking care of those. What we did was put significant resources into these stations that were outside of the bond capacity to improve the lives and safety of our firefighters. This is just a few pictures of some of the conditions. Again, just broken equipment, the counters, broken tile, water that's gotten inside the building. All these are things that our firefighters are dealing with, and these are all things that are currently being managed right now with last year's funds. But with the construction delays, it's actually in progress as we speak right now. So for goals, I'm not one that likes to report that we fail at anything, but it is honesty, and we have failed at several of our goals. So we did meet our training goals, but meeting the one occupancy, or one time for every occupancy, we only got to 66%. That is way up from COVID years, but we're also going to be initiating some new programs in '23, in addition to the new deputy fire marshal to help reach that goal. We did continue to replace outdated equipment, apparatus, replace several vehicles last year. We did not meet all of our response timeline goals, but I do want to point out again, we were not seeing bad outcomes. We did complete diversity and inclusion training, and we did start with the addition of a new assistant deputy chief, which is now our assistant chief of admin and planning, that we are analyzing 100% of our large incidents to see how we could do better. But we're also looking at least 10% of those EMS calls that require an intervention to make sure we could do better. So who does this? These are our personnel, again, our work chart. We did add new positions in 2022. We did add a part-time administrative assistant and 2 full-time mobile integrated healthcare workers. So our total is 114, which is up from, I think it's one of the first increases we've really had over the several years. I always point this out. One of the national standards we're held to is NFPA 1710, which is the National Fire Protection Association, and it kind of gives a guideline of how many firefighters should be on a call for single-family homes, strip malls, or what we consider high-rises, which is 7 or plus stories. The grayed-out helmets is where we're short, but again, I want to point out that not every community could handle every emergency on their own. We do have mutual aid agreements, and in fact, just a few weeks ago, had a very large apartment fire, and the fire district did provide several engines with staff to help us out. So we are still meeting the needs of our community, and that's why prevention is so important, because some of these buildings, if it did start up, we would be behind the ball, and so we need to make sure sprinklers work and everything's up to code so that we have the best chance we do of dealing with those emergencies. Looking at our diversity, so we are about 7% female. We did not have anyone identifying as any of the other genders. We have 4.3% people of color, biracial people of color, and LGBTQ is 0.8%, so it's one person in our department. I want to point out these are all self-reported statistics, so it's whatever they wanted to report. We don't have anything that we dug into to figure out if it was anything different. For stations, we do have technically 6. We have one that's out of service. That's the one that is with the red with the line through it. That is the old Station 1, used to be referred to as the old headquarters. That is the one that was damaged in the flood. It is also the #1 priority from the bonds that were just issued to go ahead and get started on the remodel so that we can move back in. We are in a temporary station, again, thanks to the city administration for letting us take over a nice lawyer's office and somehow convert it into a fire station. And then you'll see the others. The ones that are identified by stars, that's our training and logistics facility. If you'll remember, we've talked about at the bond hearings and some other things, that is a leased facility, and it is in the city's best interest to build one that we own, which is another bond project that we'll be starting in '23. And then there's the fire training tower, which where that star is hopefully where that training logistics facility will move to. Talking about ISO, which is the Insurance Service Office, in 2022, we actually received this rating. We made the announcement in '21 when they let us know, but it went in effect in February of '22. We were moved to an ISO 11X, which, for those that you do not know, fire departments across the nation are rated on a scale of 1 to 10. 10 means no fire protection, 1 is the best. So everyone here in Bloomington has the best fire protection service based on those standards. Now, it's not just the fire department, and I need to make sure we give credit where it's due. It's about half of the score is from the fire department, about 40% of that is from City of Bloomington Utilities with the water system hydrants, and then 10% of that comes from Central Dispatch on how they handle our calls and get us out the door. But as a combined effect, we are actually one of the best rated. We were the first city in Indiana with this rating, not to be confused with the first ISO 1 in the state, but the first city in the state. that had that rating, and I think we're the 4th overall in the state. I will point out with this, a lot of this comes down to support from the administration on staffing, but it also gets into those response times, training hours, and everything else that we have that we need to do. I want to finally touch up on one thing of our 2023 goals. We have a lot of reoccurring goals that stay the same from year to year, but for us, I just want to point out a few things that are different. Knowing that we are not meeting the goal of getting to every building every year, there are some buildings that don't need to see us every year. So we are looking to identify and start an online self-inspection program similar to what HAND does. If you meet these requirements, then you don't have to see them every year. We've also put out guidelines because there is so much construction going on in Bloomington that the person that does the plan review gets them out in a timely manner so that the people know what to expect. The others come down to our mobile integrated healthcare. We're working on what we refer to as super users. There's not a clear definition of what that is, but if they're calling 911 a lot, those are the people we're focusing on so that we can start eliminating those calls and not continue to go to them. And then again, we do have new positions, so 2 more community EMTs, which is our mobile integrated healthcare workers, and a new deputy fire marshal, and that person's focus is going to be working on the false alarms. So with that, we have been serving this community for over 123 years, and we are very proud of our personnel, the job they do 24/7, and I will turn this back over to Mayor Hamilton. Thank you.
Thank you. We'll try to wrap this up quickly. I do want to thank all 3 of you for your reports, your leadership. I believe there's another elected official who's coming into the room, County Council Member Jennifer Crossley. Thank you for being here. Good to see you here. That is a lot to digest from our public safety officials. It reflects an extraordinary set of professionals, their commitment, and the service that we all benefit from every hour of every day. I'm going to just emphasize a couple key points. During that last year, you saw the CALIA accreditation re-accredited from the police. About 5% of the 18,000 police departments in the country received that. You also saw the ISO #1 rank. About 1 out of 500 fire departments in the country receives that. And I like to remind ourselves that we are the only city in Indiana with a CALIA-accredited police department and an ISO 1-rated fire department. The only city in Indiana. We're very proud of that and reflects the quality of our professionals, the investments of City Council and our administration, and the commitment of our whole community to public safety. The 2022 reports we just heard indicated overall crime down 1%, but steady, including steady annual reductions and reductions in robbery, aggravated assault, burglary, and theft, but overall violent crime increase of almost 6%. And the number of crimes involving firearms continues to threaten us in Bloomington, as it does nationally. You heard our police department has taken specific efforts to address this very real issue, as well as Community and Family Resources Department. I will note I can't say the same for our state government. I wish they would take that on as we are locally, and gun violence particularly. We do appreciate some of the steps at the national level on that. Locally, you heard our efforts about working with federal agents and more forensics, keeping firearms out of the hands of people that can't legally possess them. Also, we do have a planned gun buyback program, getting gun locks into the community. I want to thank Moms Demand Action for their work on that, and a new grant program focused on gun violence. As you heard, we hired 6 new officers, but lost 11 in the police department to retirement or transfers. We'll return to this challenge shortly. In addition to the new positions in social work, et cetera, we have a long tradition of progressive policing that we continue to see work. Our fire department exceeded training hours with ample community engagement, and despite an increase in calls, as was mentioned, the first fatality in 6 years, an unprecedented record for our fire department over that period. And also the integrated health care program. You didn't hear directly, but we do see increasing staffing levels, raising concerns in our fire department. I believe there are 9 vacancies in the sworn officer ranks of 99, so that's been a number that we've seen increasing. Now, I want to put all this in context just briefly, and we'll get to questions. All of this progress has been supported financially by this community. First, in 2016, with a public safety local income tax of a 0.25% added to the countywide tax that is very significantly supports dispatch and all countywide police and fire needs. That was a critical step. Also in 2022, our community added economic development local income tax, a portion of which has been dedicated to public safety, about $4 million new revenue per year. Just last month, we saw the adoption and appropriation here in this room of $32 million in new public safety facility investments. The new police headquarters and co-located fire administration to be in the Showers Hall building right behind us here, which will be a very important unification of public safety with City Hall in general that will allow for very significant growth and improvement supporting all these progressive efforts. In addition to the Showers project, several new fire stations and facilities underway, new improvements, Downtown Station 1, North Woodlawn Station 3, and as mentioned, a new fire department training and logistics center. So a lot of things are underway. Among all of this, probably the greatest challenge continues to be personnel. Nationally, every city and state in America seems to be struggling to hire and retain sworn police officers. As I mentioned, we're seeing increased pressures in fire personnel as well. We have taken very significant steps to address this already. Some have been mentioned. We negotiated a police contract with significant increases in compensation effective this year, building on the federal American Rescue Plan Act supported increases provided last year. Council support has been essential to this. Fire personnel are in an existing contract that runs through 2024. We have created new housing incentives, 18,000, these have been mentioned, signing bonuses, down payments, rental assistance. Currently, 3 firefighters and 11 police officers are using those incentives. We have added take-home cars, as mentioned, with several dozen receiving take-home cars in the police department. But we need to do more. As mentioned, we have a new position this year, a full-time position that will focus on recruiting new officers for police and fire. We have also activated a 911 review task force. This is a collaborative countywide effort to review how we respond to emergency calls. Can we do it more efficiently? Can we identify ways to lessen the burden on sworn police and fire department personnel? The 988 service, the Stride Center are examples already underway. And today, I'm concluding by announcing 2 more major steps we'll be taking to enhance public safety, in particular focused on hiring and retaining our sworn police and fire personnel. First, we plan to enhance compensation at the Bloomington Fire Department. Now, they have a labor contract that extends through next year, 2024, adopted by the union members in 2020. Outside that contract, we have already increased several enhancements with a $1,000 bonus this year, $780 matching for pension investments, increased investments in health savings accounts, and others. Today, I'm announcing additional support for current and new firefighters outside the existing negotiated contract. We will offer additional bonus compensation this year to bring their compensation increases to a 5% level. The negotiated level was about 2%. So we're outside the contract, matching Civil, City, and AFSCME from their negotiated amount. And we have indicated we will plan to seek a similar level of increase for next year, assuming our finances allow it and if it's supported by City Council. Second, I'm announcing today a new pilot program for a major new housing incentive, applying both to sworn police and fire, current or new officers. This reflects the concept that having first responders live in our city is valuable. It's valuable to the city and to the neighborhoods where they live. It's valuable to public safety by bringing and building deep and broad community connections throughout our public safety efforts. Therefore, beginning today, in a pilot program, we will be offering each of up to 10 firefighters and 10 police officers a $100,000 no-interest down payment loan to buy a house in the city. Each loan will be forgiven $10,000 per year over a 10-year period. This will do at least three things. First, it will let individuals buy homes they otherwise could not afford in the city, participating directly in the great quality of life that Bloomington offers for them and their families. Second, it will let those participants build family stability and wealth over time with a $10,000 gain in equity per year, resulting in a $100,000 home equity after 10 years. And finally, it will help integrate 20 first responders into our community for the long run. We plan to fund this program with a combination of one-time American Rescue Plan Act funds, the federal funds that we so appreciate from the Biden-Harris administration and Congress, as well as ongoing annual budgets from the two departments. We are collaborating with local banks and financial institutions to implement the program, which can be combined with any existing external homebuyer supports already available. If, as we hope, the pilot demonstrates success in retaining existing and attracting new sworn officers, we will explore with City Council ways to expand it. Bloomington is very well served by highly trained public safety professionals every hour of every day. Dedicated people put their lives on the line for us every time they put on their uniforms. Our world is changing in public safety. Technologies and techniques are evolving, expectations evolve, challenges continue. And our report today, I hope, demonstrates the high level of public safety, but also the importance of continuing to invest and to innovate. I'm very pleased to share these announcements and the full state of the public safety report today. I may ask the other three of you to come up, and any of us will be happy to try to answer any questions that you may have. Thanks very much. Any questions? Going once and going twice.
How much time have you allotted for questions?
We're a little over our time, but I'm happy to answer a question or two.
I've got a page full. I'm not sure what the right approach would be. Let me ask one and see how it goes. Will the administration be recognizing the dispatchers union?
That's a question I can't answer that right now. We're in discussions with them and look forward to resolving that in short order.
Detail about when we're going to actually see stuff happen in the outside world in connection with the transition from the 3rd Street Police Station to the Showers Building and the reconstruction of the fire station. So are we going to see construction activity or at least demolition activity for the fire station yet this year? And the other part of that question, how is the police union getting looped into this planning process at this point?
Let me take a crack, and I may ask Chief Moore to talk about the fire station schedules, and Chief Dekoff if you want to add too. We have a request for qualifications on the street for an architect to work on the Showers Building. We expect that to be resolved in the next few weeks, and that the planning and design process for the Showers Building will begin in short order. I would expect within 60 days that will be a multi-month process, and we do expect in the Showers Building to see construction beginning this year, this calendar year. I expect it will conclude next year, but we'll know more about that once we get the detailed architecture work going. That process will definitely involve all of the interested parties, frontline police officers, fire administrators, and the other folks who will be using the building will certainly be involved in the design process. Chief Moore, maybe you can talk about the fire buildings.
Thank you for the question, Dave. So for Fire Station 1, we were actually in the process of remodeling that building before the flood. So we have resumed that process. We would anticipate contracts going out for the full engineering designs within the month. And then at that point, we would be able to start putting a timeline on actual deconstruction and reconstruction of that building. Station 3 and the new training logistics facility, we're just starting the point of developing the RFQs, the request for qualifications, so that we can start the process of engineering designs and looking at what that looks like. So I would say that one, our goal is to actually start all of these projects and hopefully break ground by the end of the year.
As long as you're still standing there, I want to follow up with a question about station design, because you mentioned poor station design as one of the contributing factors to slower response times than what would be ideal. And I was wondering if you could give us a specific example of, say, a feature of the new station that will specifically enhance response time, or maybe some design feature of an existing older station that inhibits a faster response time?
Actually, it's another great question. So the thing that I can point out is there's a lot of communities that do exception reporting. So when they don't meet their goal, they start tracking it. For us, we've started tracking why. It seems very silly, but a great example I can give you, not from Bloomington, but Chicago that did this, realized by adding more restrooms that their nighttime response times were improved. If everyone gets up and then has to use the restroom, not having enough facilities was causing delays. For us, looking at Station 1, currently the pole that goes from the third floor down is the fastest way. That's how that building was designed to meet our goals. It is also not used by everyone. So looking at the future, that pole design is no longer allowed under current construction guidelines. You have to go down a floor and come across because someone can really get hurt going down a 40-foot pole. Other things, I know the police chief will tease me about this a little bit because he does often, but there's other things you can look at as like slides. It's a lot safer than doing a vertical drop. So these are all things that we're considering in the new design. But ideally, you would want a one-story station. That doesn't work in all locations. When we look at Station 3, making sure that everything is centralized around the vehicle. A lot of stations start spreading further out, and then you have to go further travel distances to get to those trucks. So those are all things that we look at and we consider when we're looking at these new buildings or upgraded buildings. Thank you.
Happy to take more questions later, maybe in other settings too, if you want, if there's anybody else who has a question. Otherwise, we will, yes, ma'am.
Jennifer Resident Council. There's a lot of things that I see that the city is doing well in. And we already know that Bloomington is also part of Monroe County. As a colleague on the county council, one of my biggest things is to really hope that we can all collaborate together. And obviously with public safety, sheriff's department, a lot of different things that I see here, the county could also definitely get willing. I'm just one that would definitely want to. But I'd like to see, and this is for anybody, is what do you see that the county can do to help with the quality of public safety?
You want to start? I'll finish up.
Thanks for the question. So over the years, we've done a lot of joint training together. We have a combined critical incident response team with city and county officers. So we've done different training things, we've done different operational things together, and I think continuing those and then looking at how we police in the future are things that we can look at. There's a new sheriff. He's new to county law enforcement, so I'm sure he's really overwhelmed. But at some point, probably in the next couple of months, I'm sure we can sit down and look at different things that we both do that will benefit both the city and the county and try to make it more efficient. So.
Thank you. And I know that county government doesn't necessarily oversee the county departments, but we do have the fire district, Ellettsville, and there's still one volunteer department that is still in operation, Bean Blossom. So we continually work with our partners. In fact, it's part of our annual goal to constantly try to improve those relationships. Over the years, we've done things like we're all on the same radio system. We do similar training. We have a lot of the similar training requirements for positions. And then we also go out and we do trainings as we can into their area, and they come into our area. So when we have things like the apartment fire I discussed, they came in, integrated into our system, and we just all work together and resolve the issue. So I think on the fire side, we're constantly making progress towards that. But again, we could always do better, so thank you.
You want to add anything? You don't have to, but if Thank you for the question, Councilmember Crossley. One general point, I do think it's, as mentioned, important for the public to know there is a deep and long and exceptional amount of collaboration at first responders among county, city, and regional, and that's a great thing. Mutual aid and fire, responding to needs in police encounters and such, working together on specialty teams. So that's a really important and good thing. Two specific things I'd mention. The 911 review is a very broad county-wide look, and I think is a really important way for us to think about how do we respond to emergencies. There are communities around the country that are quite significantly changing that, and I think that's something that we can do together, and that team several folks are leading, but involving everybody who responds to 911 will be really important. And then the last thing is a more general point, but I do think, and I've said this before on some occasions, much of public safety is driven by public health. Investments in public mental health, investments in substance use disorder, investments in housing, investments in those kinds of things. The county leads on public health explicitly with a public health department, and as I think you know, I have been an advocate to do serious and immediate more investments in public health with some of the national money that we have locally. I think we have a crisis of public health that we see in our community, and I think sharing together an approach to look at how do we advance public health with mental health investments, with substance use disorder. As you know, that can have a direct impact on our criminal justice system as a whole. I think it's a really important immediate step we ought to be taking, and something we can do together very well, I think. Thank you all. We've gone a little over, sorry about that, and that's the 7th Annual State of Public Safety for Bloomington. Thanks a lot. Thank you all.